let's talk about homocysteine and its implications for mental health. So first of all, homocysteine is not a nutrient. It's not a supplement. It's not something to look for online. It's a lab result. It's a marker that tells us about how well B12 and folate and the pathway that those two involve works in the body. When homocysteine is really elevated, that's like its own medical issue. It's called hyperhomocysteinemia. It has a code. It has a long list of conditions associated with it, and it needs to be addressed. But even when homocysteine is elevated somewhat, it tells us that something is off, that likely the B12 and folate levels are inadequate for that individual, and that might be contributing to whatever mental health issues they're presenting with. Maybe depression, maybe cognitive issues, other things that might be going on. So it's a simple lab that usually a primary care doctor will not obtain unless there's something really going on. So this would take the patient advocating for themselves or just getting it checked on their own, because now you can order all kinds of labs yourself online. You should definitely have someone with a medical degree look at the results and evaluate and tell you how to interpret them. It's not obvious. You don't want it too low. You don't want it too high. Homocysteine that is too low is a problem too. But if it's too high, it's a problem for sure, right? So we're aiming for somewhere like around 8 or 9, right? So that's, if you check your homocysteine, that might be a ballpark area where you would want it to be. If it's way higher, way lower, it would tell you there's an issue. What are the health risks associated with very high homocysteine? A long list. For example, vascular disease, bone issues, cancer, Parkinson's disease, Alzheimer's, cognitive issues, also depression, schizophrenia, and all kinds of other neuropsychiatric issues. And high homocysteine can be neurotoxic and contributes to oxidative stress. So catching a very high level would be very important and very important to address it. Amazingly, it can be treated with vitamins, with folate and B12, right? So if figured out, there's something you can do about it. It's treatable, right? You can treat it whether it's in yourself or in your patient, which is a wonderful thing. That's an easy treatment. And then track it and monitor and make sure the homocysteine level comes down. So, if you catch a high homocysteine, you would also want to know about folate and B12. Maybe you would also want to know about MTHFR and whether someone has major mutations such as a double 677T mutation in MTHFR. So if that's caught, then it's, you can start to understand like the whole picture of what's going on. And if homocysteine comes back perfectly normal, right, that is also reassuring that maybe someone does not need folate and B12, that the methylation detoxification pathway is running just fine and they don't need supplementation. So important because it matters for many health conditions, including mental health conditions, and an easy thing to check and an easy thing to treat. So thank you for listening.